millions of men around the world silently struggle with erections that are not as strong, not as reliable, or simply not happening when they want them to. And because of embarrassment, misinformation, and unrealistic expectations from the internet, many men end up trying random tips, like endless Kegel exercises, hoping something will magically fix the problem. But here's the reality: Kegel exercises alone are rarely the solution for erectile dysfunction. Erectile health is much more complex than simply squeezing a muscle. A healthy erection depends on blood flow, nerve function, hormone balance, mental health, and overall cardiovascular health. If even one of these systems is not working properly, erections can suffer. So today, let's talk about what actually works when it comes to improving erections, based on medical science. What if I told you that the problem you might be silently worrying about is actually one of the most common health issues men face worldwide, and yet almost no one talks about it openly? That silence creates a dangerous illusion, an illusion that if you're experiencing erectile difficulties, you must be the only one going through it. But the reality is completely different. Millions of men experience erectile dysfunction at some point in their lives. In fact, medical research suggests that a significant percentage of men over the age of 40 will experience some degree of erectile difficulty ***, and many younger men report similar struggles due to stress, lifestyle habits, or underlying health conditions. Despite how common it is, many men still suffer quietly because of embarrassment, fear, or the belief that it somehow reflects weakness or failure. Think about this for a moment. Men openly talk about back pain, headaches, fatigue, and even heart problems, but when it comes to sexual health, many stay completely silent. That silence allows myths and misinformation to grow. Some men start blaming themselves, questioning their masculinity, or assuming something is permanently wrong with them. But erectile dysfunction is not a character flaw, and it is not a measure of masculinity ***. It is simply a medical condition that can be influenced by many different factors such as blood flow, nerve signals, hormone levels, mental health, and lifestyle choices. Just like high blood pressure or diabetes, erectile dysfunction is something that can happen to anyone, and more importantly, something that can often be treated effectively once the real cause is identified. Here's something else many people don't realize. Sometimes erectile problems are actually the body's early warning system ***. The blood vessels in the penis are smaller than the blood vessels in other parts of the body, which means circulation problems can appear there first. In some cases, erectile dysfunction shows up *** years before symptoms of heart disease or other cardiovascular conditions * become obvious. That means noticing a change in erectile function can actually provide an opportunity to detect and address health problems early. Another reason this issue feels so isolating is because many men compare themselves to unrealistic expectations. Movies, online content, and social media often create the impression that men are supposed to have perfect performance every single time. Real life is not like that. Stress, fatigue, relationship dynamics, work pressure, sleep problems, and emotional strain can all temporarily affect sexual performance. Experiencing occasional difficulties is completely normal. The problem begins when men interpret these experiences as something catastrophic or permanent. That fear can create performance anxiety, and anxiety itself can interfere with the brain signals that trigger an erection. Suddenly, what began as a small or temporary issue becomes a cycle of worry and frustration. Breaking that cycle starts with understanding a simple but powerful truth: you are far from alone in this experience ***, and countless men have faced the same challenge and successfully improved their sexual health through the right combination of medical care, lifestyle changes, and accurate information. What if the strength of your erection was actually telling a deeper story about your body? What if it wasn't just about sexual performance at all, but about the health of your heart, your blood vessels, and your entire circulatory system? This is something many men are surprised to learn. An erection is not just a sexual response, it is a powerful signal of how well your body is functioning internally. A healthy erection depends on one critical factor: strong and efficient blood flow ***. When sexual stimulation occurs, the brain sends signals through the nervous system that cause blood vessels in the penis to relax and widen. This allows blood to rush into specialized tissues inside the penis, creating firmness and rigidity. If that blood flow is restricted or weakened, the erection may become softer, slower to appear, or difficult to maintain. Now here's the surprising part. The same blood vessels responsible for erections are connected to the same vascular system that supplies blood to your heart, brain, and other vital organs. This means erectile function is closely linked to cardiovascular health. When the blood vessels become damaged, narrowed, or less flexible due to poor health habits, erections are often one of the first things affected. Think about the size of blood vessels for a moment. The arteries that carry blood to the penis are much smaller than the arteries that supply the heart. Because they are smaller, even a small amount of plaque buildup or reduced circulation can interfere with blood flow much earlier. In other words, erectile dysfunction can sometimes appear years before a man develops noticeable symptoms of heart disease. This is why many doctors consider erectile dysfunction an early warning sign rather than just a sexual issue. It can indicate underlying problems such as high blood pressure, high cholesterol, diabetes, or vascular disease. Instead of ignoring these signals, paying attention to them can actually help protect long-term health. Lifestyle choices play a huge role in this connection. Habits like smoking, lack of exercise, poor diet, and chronic stress can slowly damage blood vessels over time. Smoking, for example, causes the blood vessels to narrow and stiffen, reducing their ability to deliver blood efficiently. A sedentary lifestyle weakens circulation and can contribute to weight gain, which in turn increases the risk of diabetes and cardiovascular problems. On the other hand, positive lifestyle changes can dramatically improve both overall health and erectile function. Regular physical activity helps improve blood vessel flexibility and circulation throughout the body. Exercise increases nitric oxide production, a natural chemical that allows blood vessels to relax and expand more easily. This same process is essential for achieving a strong erection. Nutrition also plays an important role. Diets rich in vegetables, fruits, whole grains, lean proteins, and healthy fats support vascular health and help maintain stable blood sugar and cholesterol levels. Maintaining a healthy weight can improve hormone balance, including testosterone levels, which also influence sexual function. Sleep is another factor that many men underestimate. Poor sleep disrupts hormone production, increases stress hormones, and can negatively impact testosterone levels. Over time, chronic sleep deprivation can affect both energy levels and sexual performance. Stress itself can also affect the body's circulation. When the body is under constant stress, it releases hormones like cortisol and adrenaline, which can tighten blood vessels and interfere with the signals needed for an erection. Have you ever searched online for solutions to erectile dysfunction and suddenly found yourself drowning in thousands of miracle cures, secret tricks, and instant fixes? One website promises dramatic results in a week. Another claims a simple exercise will permanently solve everything. Social media videos show confident influencers claiming they discovered a hidden method doctors supposedly don't want you to know about. It can feel convincing, persuasive, and even hopeful. But here's the uncomfortable truth. Much of that information is misleading, exaggerated, or completely unsupported by medical science. The internet has made health information more accessible than ever, but it has also created a massive wave of misinformation. When it comes to men's sexual health, myths spread incredibly fast because people are often too embarrassed to verify the facts with a qualified professional. Instead, many men quietly experiment with random tips they see online, hoping one of them will magically solve the problem. Some of the most common myths revolve around quick physical tricks or exercises that claim to dramatically improve erections overnight. You might see claims that squeezing certain muscles repeatedly, using specific stretching routines, or following a mysterious daily ritual can permanently cure erectile dysfunction. While certain exercises may support pelvic floor strength, they rarely address the deeper causes of erectile dysfunction, especially when the problem is related to circulation, nerve function, hormone levels, or psychological factors. Another major category of misinformation involves supplements and so-called natural enhancers. Many advertisements promote herbal pills or powders that promise stronger erections, longer performance, and immediate results. The marketing language often sounds scientific, filled with phrases like clinically proven or ancient secret formula. But when these products are actually studied under proper medical research conditions, the evidence is often weak, inconsistent, or completely absent. In some cases, these supplements can even be risky. Because many over-the-counter sexual enhancement products are not strictly regulated, Some have been found to contain hidden pharmaceutical ingredients or unsafe compounds. Men who take these products without medical supervision may unknowingly expose themselves to side effects, drug interactions, or health risks. Another powerful myth comes from unrealistic expectations created by media and entertainment. Movies, adult content, and social media often present a version of male sexuality that is exaggerated and unrealistic. These portrayals can create intense pressure to perform perfectly every time, for long durations, with instant responses. Real human physiology simply does not function that way. Stress, fatigue, emotional factors, and physical health all influence sexual performance. When men compare themselves to unrealistic standards, they may start believing something is seriously wrong even when their experiences fall within normal variation. That belief can trigger performance anxiety, which then interferes with the brain signals necessary for an erection. Suddenly, a psychological cycle begins where fear of failure actually contributes to the difficulty itself. This is why relying on myths can delay real solutions. Erectile dysfunction often has identifiable medical causes, such as reduced blood flow, diabetes, medication side effects, hormone imbalances, or psychological stress. These are issues that require accurate diagnosis and evidence-based treatment. Science-based approaches focus on understanding the root cause rather than chasing temporary tricks or miracle claims. Accurate information empowers men to make informed decisions about their health. Instead of wasting time on unreliable advice, focusing on medically supported strategies can lead to real improvements in both sexual performance and overall well-being. What if the solution to stronger erections didn't start in the bedroom at all? What if it started with the small choices you make every single day? How you move your body, what you eat, how you sleep, and how you manage stress. Many men search for a quick fix, a pill, or a secret technique that will instantly solve erectile problems. But the truth is far more powerful and often overlooked. Small lifestyle changes can create surprisingly big results when it comes to erectile health. An erection is essentially a asterisk circulation event asterisk. It depends on healthy blood vessels that can expand and deliver a strong flow of blood to the penis. Anything that improves circulation throughout the body also supports better erectile function. That means the habits that protect your heart, brain, and metabolism are the exact same habits that support sexual performance. One of the most powerful tools is regular physical activity ***. Exercise strengthens the cardiovascular system, improves blood vessel flexibility, and enhances the body's ability to produce nitric oxide, a key molecule that allows blood vessels to relax and expand. When nitric oxide signaling improves, blood can move more efficiently into the penile tissues during arousal. Studies consistently show that men who engage in regular physical activity often experience better erectile function compared to those with sedentary lifestyles. Even moderate activity can make a meaningful difference. Brisk walking, cycling, swimming, or strength training several times per week helps improve circulation, reduce inflammation, and maintain healthy blood pressure levels. Over time, these improvements translate into stronger and more reliable blood flow throughout the body. Nutrition also plays a critical role in vascular health. Diets high in processed foods, excess sugar, and unhealthy fats can damage blood vessels and contribute to plaque buildup in the arteries. When arteries become narrowed or stiff, blood flow becomes less efficient, because the penile arteries are relatively small. Even minor circulation problems can affect erectile quality. On the other hand, diets rich in vegetables, fruits, whole grains, lean proteins, and healthy fats support better blood vessel function. Foods that contain antioxidants, fiber, and beneficial fats help reduce inflammation and maintain healthy cholesterol levels. Maintaining stable blood sugar is also extremely important because chronic high blood sugar can damage both blood vessels and nerves, increasing the risk of erectile dysfunction. Weight management is another key factor. Excess body fat, especially around the abdomen, can disrupt hormone balance and reduce testosterone levels. Lower testosterone can contribute to reduced libido, fatigue, and decreased sexual performance. Losing even a modest amount of weight can improve metabolic health and help restore healthier hormone patterns. Sleep is another area that is often underestimated. During deep sleep, the body regulates hormone production, including testosterone. Chronic sleep deprivation can interfere with these hormonal cycles, leading to reduced energy, lower sexual desire, and weaker erections. Prioritizing consistent, high-quality sleep helps maintain the hormonal balance necessary for sexual health. Stress management is equally important. When the body is under constant stress, it releases hormones like cortisol and adrenaline that prepare the body for survival responses rather than relaxation. These stress hormones can narrow blood vessels and disrupt the brain signals needed to initiate an erection. Chronic stress can also reduce sexual desire and create mental distractions that interfere with arousal. What if the biggest misconception about erectile dysfunction is the belief that nothing can truly fix it? Many men quietly assume that once erections start becoming weaker or unreliable, it's simply something they have to live with. Others believe that the only solution is a single pill, and if that doesn't work, then there are no other options. But modern medicine tells a very different story. In reality, there are multiple highly effective treatments available today and new therapies continue to evolve as medical science advances. The first and most widely known treatment is oral medication, designed to improve blood flow to the penis. These medications work by enhancing the natural signaling pathway that allows blood vessels in the penis to relax. When those blood vessels relax, they can fill more effectively with blood during sexual stimulation, creating a firmer and more sustainable erection. For many men, these medications provide a reliable and convenient solution when used properly under medical guidance. But what many people don't realize is that these medications are only one part of a much larger toolkit . If pills are not effective or cannot be used because of certain medical conditions, doctors have several additional treatments that can restore erectile function. One option involves vacuum erection devices . These devices create gentle negative pressure around the penis, which draws blood into the erectile tissue. Once the penis becomes firm, a small ring placed at the base helps maintain the erection during sexual activity. While this approach may seem mechanical at first, it has been used successfully for many years and can be especially helpful for men who cannot take oral medications. Another highly effective option is penile injection therapy . This treatment involves injecting a very small amount of medication directly into the side of the penis using a tiny needle. The medication works locally to relax blood vessels and rapidly increase blood flow, often producing a strong erection within minutes. Although the idea of an injection can sound intimidating at first, many men find the process far easier than they initially expected once they receive proper instruction. Hormone therapy may also play a role in certain cases. If testing reveals that testosterone levels are significantly low, correcting that hormone imbalance can improve sexual desire, energy levels, and sometimes erectile function. However, hormone therapy is only appropriate for men who truly have clinically low testosterone, which is why proper evaluation is important. Another emerging treatment that has gained attention in recent years is low-intensity shockwave therapy . This therapy uses gentle sound waves applied to the penile tissue with the goal of stimulating new blood vessel growth and improving circulation over time. While research is still evolving, early studies suggest that this approach may help some men improve their natural erectile function by addressing underlying vascular issues. For men with severe erectile dysfunction who do not respond to other therapies, penile implant surgery offers one of the most reliable long-term solutions. Penile implants are medical devices surgically placed inside the penis that allow a man to create an erection whenever he chooses. Modern implants are highly advanced, discreet, and associated with very high satisfaction rates among both patients and their partners. The most important thing to understand is that erectile dysfunction rarely has only one universal solution. The best treatment depends on identifying the underlying cause, understanding individual health factors, and selecting a therapy that fits each person's needs and lifestyle. Modern medical care focuses on personalized treatment strategies rather than one-size-fits-all approaches. What if the biggest barrier between you and better sexual health isn't biology, age, or even medical conditions, but hesitation? What if the real obstacle is simply waiting too long to do something about it? Many men notice changes in their erections and immediately hope the issue will disappear on its own. Days turn into weeks turn into months, and sometimes even years pass before they seriously consider addressing it. But the truth is simple and powerful. The sooner you take action, the greater the chance of improving both your sexual health and your overall well-being. Ignoring erectile dysfunction might feel easier in the short term. It avoids uncomfortable conversations and allows the problem to stay private. But erectile changes are rarely random events. In many cases, they are signals from the body that something deeper may need attention. Blood flow problems, hormone imbalances, metabolic conditions, medication side effects, stress, and lifestyle factors can all influence erectile function. When these issues go unaddressed, they can continue progressing silently. Think about how people treat other health symptoms. If someone experiences persistent chest pain, severe headaches, or difficulty breathing, they usually seek help quickly because they recognize those symptoms might indicate something important. Erectile dysfunction deserves the same level of attention because it can also reflect underlying health concerns, particularly those related to cardiovascular health. Another reason early action matters is because erectile dysfunction can gradually affect confidence and emotional well-being. Sexual health is closely connected to self-esteem, relationships, and overall quality of life. When erectile difficulties continue without being addressed, many men begin to experience frustration, embarrassment, and anxiety. Over time, this emotional strain can create a cycle where worry about performance actually worsens the problem. Taking action breaks that cycle. Seeking accurate information and professional guidance can transform uncertainty into clarity. Instead of guessing or experimenting with unreliable solutions, a proper evaluation can identify the specific factors affecting erectile function. Sometimes the solution may involve simple lifestyle improvements such as better sleep, increased physical activity, or dietary changes. In other cases, medical treatments may provide significant improvement. Another important aspect of taking action is communication. Many men keep erectile concerns completely hidden from their partners out of fear of judgment or embarrassment, but open communication can actually strengthen relationships. When partners understand that erectile dysfunction is a medical condition rather than a reflection of attraction or interest, it often reduces tension and allows both people to approach the issue as a shared challenge rather than a personal failure. Education also plays a powerful role. The more men understand about how erections work, the easier it becomes to recognize the factors that support or interfere with sexual health. Knowledge replaces myths, reduces unnecessary fear, and helps individuals make informed decisions about their bodies. The idea of taking action does not mean rushing into drastic treatments or complicated procedures. It simply means choosing to address the issue instead of ignoring it. It means recognizing that sexual health is an important part of overall health and deserves the same level of care and attention as any other aspect of the body.